Both houses of the Tennessee General Assembly have approved the Katie Beckett waiver bill, which offers Medicaid coverage to disabled children with complex medical needs, regardless of their parents' income. News Channel 11's Kristen Gallant spoke to a Tri-Cities mom who has been advocating for the bill since the very beginning.
The Katie Beckett bill will be signed in a formal ceremony by Tennessee Governor Bill Lee on Thursday. Mallory Hatcher of Johnson City is one parent who will be there for that signing. She says this is a huge accomplishment for families with children with complex disabilities.
Oh, this is the really good one. You know, I didn't realize that it would all come together and happen for sure when we started advocating for this with other families earlier this year. So it's just really awesome to see it come together.
The Katie Beckett waiver went from legislation to bill on May 24th. The bill will help families with disabled children who make too much money to qualify for TennCare coverage. Tennessee was the only state in the country to not have this type of program.
You know, a lot of our children have, you know, long-term complex medical needs and disabilities, so it was important to us that once they get enrolled into the program that we don't have to stress about them getting kicked or booted out of the program.
Once the bill was passed,
from that point forward, TennCare and DIDD have 120 days to get it to CMS for approval.
Hatcher and other parents have been traveling the state asking for input on the bill from other families. The group traveling to Knoxville just last week for a live input session.
It was very concerning for some families who would be switching from TennCare to Katie Beckett.
Those parents concerned they might lose their services if their child made a certain amount of progress. And another concern,
a lot of our children have very rare and complex diagnoses. So, you know, it is our hope that it's need-based versus diagnosis-based.
Parents also hoping that the enrollment process is simple. The bill separated into two parts.
Part A is going to be more of a, from what they're saying right now, will cover around 300 kids, and the other 2,700 kids or so will be covered under Part B.
Part A will be for higher need families whose children need full service care like nursing facilities. Part B is to fill the gap on what private insurance won't cover. Hatcher saying this is a big step for families to get the care they need for their children.
All aboard!
And Hatcher says that Part A will probably go into effect more quickly than Part B. The Centers for Medicare and Medicaid Services still have to approve Part B. In the newsroom, Kristen Gallant, News Channel 11.
Kristen, thank you. And Hatcher says there will be more time for formal input on what parents want the Katie Beckett bill to look like after Thursday's ceremonial signing.